Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and I'm excited about the topics that we're going to cover over the next several weeks. We're actually going to be talking about something that impacts every single person on the planet, whether you know it or you don't. And it is probably the one of the most relevant topics as well when it comes to all chronic diseases, and that is the topic of inflammation. Because when you hear the word inflammation, it's like, what comes to your mind? We probably think about inflammation and, it's areas of redness and swelling that follow an infection, a wound, or an injury. But this is only like what we call acute inflammation, which is a beneficial response, by our bodies, by our immune systems that encourage healing, and usually goes away once the injury improves. But chronic inflammation is a whole nother thing. That's a form of inflammation that is much less obvious. And while your immune system becomes activated and that inflammatory response stays around all the time at a very low level, that's not healthy for you. And this is not like the acute inflammatory response that just sort of comes and goes with infection or injury. Now, in other words, chronic inflammation may begin even when you have no injury at all. Worse still, it does not end when it actually should. There are several factors that could trigger chronic inflammation, from lifestyle factors such as poor sleep, obesity, exposure to environmental toxins, poor dietary habits, and we'll start to cover some of those as we go through this. But some of the common symptoms of chronic inflammation are going to be what we're going to cover right now. Now, symptoms like pain, redness, and swelling are very common amongst acute or fresh inflammation, but the symptoms of chronic inflammation are a little bit more subtle. So it's very simple and very easy for us to actually overlook them, but symptoms of chronic inflammation would be things like, it could be body pain, it could be fatigue, it could be weight gain, could be gastrointestinal complications like constipation, diarrhea, acid reflux, indigestion, could be sort of persistent infections, things like depression or anxiety. And these symptoms, they can be mild, they can be severe, they can go all hosts of range, and they can last for months or even years. So the question becomes, how does chronic inflammation damage the body? Well, chronic inflammation can cause damage in a lot of different ways, but it can damage everything from your DNA. It can trigger things like heart disease, cancer, aging, and unlike acute inflammation, that promotes healing and recovery for better health, chronic inflammation causes a persistent increase in inflammatory proteins all throughout the body, and this can damage healthy cells, tissues, organs, glands, and even trigger several major diseases. Unfortunately, most people don't know that they're suffering from chronic inflammation until it becomes too late. And typically by the time you become aware of it or you feel it or it shows up on some test, it's been going on for a long time. So many individuals, are unaware that they have chronic inflammation, but then only after they develop something like an autoimmune disease or a diabetes or a lupus or like some sort of Crohn's or something like that. And chronic inflammation also has an impact on aging. It's been shown to cause what's called oxidative stress, which we've talked about a ton on this podcast before. And it also has to do with an imbalance of things like dangerous free radicals, molecules that, can cause healthy tissue to be damaged in the body. But also, we need to make sure that we have really strong antioxidants, which are substances that neutralize and clean up waste products. So all of these imbalances that occur with chronic inflammation can cause damage to our DNA, as well as fatty tissues and other proteins in the body, which turn to speed up what we call biological aging. Like your chronological age, this is how old, this is when I was born, this is the age I am now. That's one thing. But your biological age, how old your body is based on the wear and tear over time that it has received, is a completely different thing. And I don't know about you, but I prefer to have my biological age be as young as possible, ideally younger than how old I am right now. Now, chronic inflammation contributes largely to cognitive decline and mental health disorders as it boosts age-related immune system deterioration as well, which is called immunosenescence. You don't need to know that, but that's basically the term that they use instead of saying in the research literature, age-related immune system deterioration. Now, chronic inflammation also affects a lot of other disease conditions. It's involved in a wide variety of serious physical and mental health conditions. Experts believe that chronic inflammation plays a role in developing kidney disease, heart disease, cancer, non-alcoholic fatty liver disease, cognitive decline, neurological disorders, and mental health illnesses such as post-traumatic stress disorder, depression, and even schizophrenia. So you can reduce your risks of suffering from chronic inflammation by making certain not only behavioral changes, but also lifestyle changes. And you want to make sure, as always, that we're treating the underlying cause of what is creating this inflammatory response. Now, I know that was a lot. I know some of that was a little bit heady, but just hang in there, because over the next couple of weeks, we're going to be talking about sort of the top sources of inflammation. Which are the ones that you want to actually avoid? What are 6 ways to reduce chronic inflammation in the body? And whether you have a chronic condition or not, these are just really good practices to keep your body healthy and strong. And then what are the top 4 inflammatory foods and the top 4 food swaps that you can do as well? So I hope you love this podcast. This is Dr. Jason Jones signing off from Health Made Easy, your practical voice in a world of confusing information. And we will see you on the next podcast. See you later. Bye-bye.